Hello, my name is Matthew McKinley. This is a presentation that was created for HPR 2120 Adapted Physical Education. Today we'll be talking about spinal cord injuries. Spinal cord injuries by Matt McKinley. Definitions and symptoms. A spinal cord injury, or SCI, is damage to the spinal cord that causes temporary or permanent changes in its function. Symptoms of a spinal cord injury may include loss of muscle function, sensation, or autonomic functions in the parts of the body served by the spinal cord below the level of injury. When discussing spinal cord injuries, it is important to understand what types of injuries occur. The two most common are incomplete and complete. On the left, we can see an illustration of an incomplete injury. In this instance, the spinal cord is only partially severed. On the right, we see an illustration of a completely severed spinal cord. With an incomplete injury, you may see paralysis as the most extreme case of injury. However, it is possible that the injury causes only partial paralysis or even symptoms including loss of sensation. In a complete injury, paralysis is certain, whereas the recovery is unknown. The height or location of the injury will determine the severity of the injury, as we'll discuss later in this presentation. Every year, approximately 12,500 individuals are victims of SCI, with 240 to 337,000 individuals living with SCI injuries currently, depending on their classification. Of the individuals living with spinal cord injuries, about 60% are listed as incomplete SCI. 80% of all spinal cord injuries are men. This is attributed to the higher likelihood of on-the-job injuries due to heavy lifting and environmental factors such as falls and vehicular accidents. Of the 57% were employed at the time of their injury, meaning simply that they had a job at the time. In a study done by Liddell and colleagues, approximately 21% of individuals returned to work following an SCI, the largest factor being age at the time of injury. White males were listed as the largest ethnic group who were victims of SCI. I thought it important to note that even though Caucasians were the highest listed, African Americans were disproportionately represented, making up 23% of SCI injuries, even though they make up a small 13% of the population. Motor vehicle accidents occur for almost half of all SCI. This is rated at 47%, followed by falls as the second most common source of injury, accounting for 21% of all injuries. Interestingly enough, 66% of spinal cord injuries are related to diving. The high speeds leading to forceful collisions with the water create a dangerous environment, leading to a higher likelihood of getting a SCI than if one were to participate in a body-to-body collision sport. 52.8% will eventually develop pressure ulcers as a result of sitting in wheelchairs or other assisted devices, and 60.3% of SCI victims will develop pneumonia due to conditions exacerbated by atypical mobility. Related spinal cord injury costs. Spinal cord injuries vary in cost. This slide demonstrates the variance in cost due to the severity. A higher injury resulting in tetraplegia or quadriplegia in the first year costs on average over $1 million, with costs reaching as high as $180,000 per year following. High tetraplegia differs from low tetraplegia, and that with some cases, those with the lower tetraplegia still maintain some use of upper body functioning. Paraplegia is the result of an injury that causes the body to lose function in two limbs, whereas incomplete motor function is described as slight or temporary loss of functioning. On average, the United States spends about $9.7 billion on treatment of spinal cord injuries. In order to understand spinal cord injuries, it is easiest to look at the spinal cord in its four sections. Vertebra C1 through C8 make up the cervical section of the spine. T1 through T12 make up the thoracic section, L1 through L5 the lumbar, and S1 through S4 the sacral. The picture to the right gives an idea of how the body might be affected by a spinal cord injury depending on the location. It is common that wherever the spinal cord injury occurs, the body below that section of the injury will be affected. For example, an injury at C1 will affect the body from that point all the way to S4 in most cases, whereas an injury at L1 will affect only the following sections: This is why higher injuries are more aggressive. Cognitive characteristics of SCI. Reports from the references cited show that anywhere from 10 to 60% of individuals with SCI show cognitive deficits, with 40 to 50% having varying degrees of cognitive impairment. Symptoms listed were those of attention loss, concentration, memory, problem solving, abstract reasoning, new learning, and high-level cognitive skills. Again, the major factors contributing to cognitive developments were dependent on the age of the injury, demographics, as well as lifestyle choices. Movement characteristics of SCI. As mentioned, spinal cord injuries have a wide range of movement characteristics, ranging from high functioning or motor impaired to the more aggressive high tetraplegia, rendering individuals completely incapable of self-movement. Behavioral characteristics of SCI. Following a spinal cord injury, it is not unlikely that an individual will experience depression and anxiety, most commonly due to physical changes in adjusting to day-to-day living. Those who have previously had issues with substance abuse should seek help early. Adjusting can be very difficult, but there are options for care. If you believe medication or therapy are something that would benefit you, do not hesitate to seek professional help. Activity settings for individuals with SCI. Upon research, it was obvious that there is a large community that helps to engage individuals with spinal cord injuries, one most recognizable being NWBA. This particular association, like so many others, uses a scale to classify individuals based on their level of motor functioning. Another very notorious association is wheelchair and ambulatory sports. They work with individuals of all levels of motor functioning in as many sports as is available to typical individuals. The list to the left is just a few of the sports they offer for individuals in wheelchairs or lower motor functioning. Common rule changes for individuals who are in wheelchairs or that use other modes of ambulation include changes in the equipment, rules, environment, and instruction. The following list shows examples of each change in order to adapt a sport for the individual. Activity 1. Most players in the game of wheelchair rugby are classified due to spinal cord injury. Other players may be classified due to multiple amputations, neurological disorders, or other medical conditions. When classifying participants, how many limbs must have some loss of function in order to participate? Communication. When talking to or interacting with an individual who has a spinal cord injury, it's important to remember that they are still a human being. It is also important to remember that any assistance they may need, be it a wheelchair or other ambulatory equipment, is considered a part of the body. Always ask if they need assistance or to touch their equipment. There's a lot of research being done in order to rehabilitate damaged nerve cells. Enzymes that inhibit nerve cells regeneration are the main issues surrounding spinal cord injuries, aside from localized physical damage. What is one study that is being done to increase recovery from spinal cord injuries? The video below will give you a little more information on different enzymes that inhibit rehabilitation of nerves. Sports and modified equipment. Many sports use modified equipment in order to accommodate individuals with spinal cord injuries. Specifically listed are modifications for downhill skiing and ice hockey. These are but a few examples of the many sports that can and have been modified to accommodate spinal cord injuries. Other examples are wheelchairs for rugby, sleds for skiing and hockey, and even specialized bikes for those who want to take part in triathlons. Lastly, I would like to talk about behavioral management for spinal cord injuries. Most patients that have been affected by SCI will demonstrate attitude, mood, and changes in character. It is important to remember that the change the individual is going through has to better manage their transition. Autonomy and inclusion must be well known for the individual, as well as providing the least restrictive environment. The earlier these changes can be adopted, the easier the transition is for the individual. Least restrictive environment and inclusion should be based on the patient. This will help to expedite the process of leading a normal lifestyle.